morning, everyone. It's so nice to see you today. So, from the very beginning of planning this day and being on the planning committee, I've just been blown away with the incredible group of people that I've gotten to work with. And I am feeling nervous and excited in equal parts. I'm not really as nervous because I know that this group of people, the people who work in our field, oh my gosh, we're just the best people. So I hope you'll understand that as I'm doing this, I'll make mistakes. I'll probably get the technology wrong, but the heart and the work is there. So with no further ado, I'm going to try and share my screen, which is already baffling me. Here we go. All right. And we're going to go into the world. Okay, I need to share sound and optimize for video clips. See, I'm learning. Oh my gosh, this is so exciting. Okay, and then we're going to go here and we're going to beginning. All right. So as you can see, can everyone see this? Okay, I can't see you now. So Jeff, can you give me a...
We can see it. It looks great.
We can see it.
Okay, great. Oh, okay. So I can't go back. So we just have to keep going now. So this is talking about, how do I go back on this screen? See, I told you, I knew I was going to do this. Hold on. Let's go back. All right. So back to the slideshow from the current slide. So as you see, this is integrating the lived experience workforce, a partnership of consumers, carers, families, and clinicians. And so the folks at St. Vincent's and the folks at the Alfred who work in this field came together very early on and said, hey, we need to make sure that the lived experience workforce is represented as an emerging workforce and also in the work that we're already doing to make sure everyone understands what the future can look like and what the current situation is really evolving as. So we'll go to the next one. So this is kind of the triangle of care model that we embraced as a team. It uses the collaboration between the clinician, the consumer, and the family care to form an effective triangle for recovery. So this is just predicated on the idea that every single part of this triangle is equally important and dependent on each other for recovery, for support, and for ongoing growth. It's a really great model. But we thought, what about an expanded triangle of care model, using lived experience, both the consumer and the family care peer support and other lived experience professionals to bolster the strengths and needs of not only the consumers and the family and supporters, but in fact, as you'll see in our presentation, the clinician as well, so that the team all works together to develop healthy and positive outcomes for all three parts of the triangle. So there's a handout that's attached to this page that you'll be able to go into more detail with this, but I'm going to go ahead and bring us into the presentation because it explains this better than I ever could. So these are the people that are playing the different roles. We've got Benita Cohen, who's our wonderful narrator. We've got Jess acting as the consumer, Tanya acting as clinician, a long stretch for her as she is the clinician, one of the clinicians. We've got Bertie acting as the consumer peer worker, a role that she also has currently at St. Vincent's in the older adult service. We've got Amanda Bond acting as care peer worker. She's a care consultant also with St. Vincent's. We've got Elise, who's acting as the daughter, really excellent acting as well. And then I just acted as the content consultant. So here we go, and we'll begin.
Welcome to the world of person-focused recovery, enhanced by integrating lived experience workforce into a partnership with the consumer and clinical team. We'd like to introduce this by way of a case study. 66-year-old Jess has experienced long-term depression. She'd been going relatively well for a number of years, but about 5 months ago, she stopped going to her social group, and she'd been increasingly struggling to manage her household chores. 2 months ago, Jess's daughter Elise visited Jess, who was sitting at the table with multiple pill bottles open, scattered all over the table. Jess stated that life just didn't seem to be worth living. Her best friend from childhood had died 2 weeks prior after a long fight with cancer. Elise, shocked and frightened, called 000. Jess was taken to hospital, treated for an OD, before being transferred to the local older adult inpatient unit for treatment of depression. After 2 months, Jess's mood had improved back to her baseline and she was discharged home with follow-up from the community team. Here we'll be presenting a role play of the scene where the community team meet with the family for the first time since Jess, the consumer, was discharged from hospital. We begin with a phone call between Amanda, the carer peer worker, and Elise, the daughter and carer of Jess. Amanda is the carer peer worker for the service. Elise and Amanda have met twice on the ward and have had a couple of conversations on the phone. They've developed a warm relationship based on the similarities of their lived experience.
Hello, Elise speaking.
Hi, Elise. It's Amanda, your carer support worker from the hospital. I'm just calling to say hi and check in and see how you're feeling in general, and I really specifically wanted to know how you're feeling about the upcoming meeting with the team, Tanya and Bertie, with your mum at your place.
Oh, hi, Amanda. Thanks for calling. Yeah, to be honest, I'm glad they're coming today. I'm starting to get really worried. Mum's not eating much and not talking much, and well, I just don't think she's okay. Mind you, I'm not sure what they can do. Truthfully, I spend so much time crying and worrying, I can barely think straight anymore.
Oh, God, that's terrible. I think I mentioned before, actually, Elise, that I've also been a carer for my mum, and I think that I know where you're coming from. It was, and it still really is sometimes, so tough. I just wanted to say that I do probably know a little bit about how you're feeling, and just wanted to let you know that that's okay. It's really normal. Remember, I've mentioned you can always call me for support too when you need someone to talk to. And, you know, in saying that, I really mean it. I mean, I do know how hard it is to manage. And also, please, if you need it, I can also make a referral for counselling services if you'd like that. So remember, it's early stages. Mum has only been out of hospital for a week.
Yeah, that's true, Amanda. I guess I didn't really know what to expect, but I didn't realise it'd be this hard. Mum's not the easiest person to live with, and I haven't been here since I was 18, and this is really tough.
Yeah, I know. Actually, I really do understand that, Elise. I feel that I can relate to that personally. I moved out about the same age, so trying to adjust to caring for mum and the role change really takes a lot of patience and strength, and it is exhausting. It's so hard to be strong all the time, especially when you're the carer. The stress and trauma of what you've gone through, though, could be helped by having some therapy or some counselling sessions for yourself. Remember, you deserve to be cared for and supported as well, especially during this time of looking after somebody else and their needs. It might help you to find some ways for you to help care for yourself, and then that will be helpful with your relationship with mum, and then also in the caring role. So what do you think about that idea?
Yeah, it sounds really good. Thanks, Amanda. I've been thinking about getting some counselling, but I didn't know how to go about it, and I'm actually really worried about the cost of it as well. I'd appreciate your help with connecting me in with someone if you know anyone.
Yeah, look, I'm really happy to support you with that, Elise. No problem. I can make a referral to Carers Victoria or Tandem Carers. If you preferred, you can even log into the Carer Gateway online yourself, and they'll connect you with an appropriate counsellor within your ability to pay. I've had really good luck with these services for many of the carers that I've worked with in the past. So if you would like that to happen, and if I can help you with that, I'm happy to. So I can also really relate to let you know to the worry about the worry of the cost of counselling. That's really put me off in the past because it's really expensive. If you're paying for counselling, and then if you had kept the receipts and sent them to me, I can apply for that to be repaid to you using the Carer Support Fund, because you're entitled to that support as a carer.
Oh, okay. Thanks, Amanda. I don't feel so alone anymore. I'm still anxious about today's meeting, though. I'm not sure who's coming or what to expect.
Oh, okay. Yep, sure. Look, just remember it'll be Tanya, the clinician. She's great. And Bertie, your mum's peer support worker, is coming too. You've already met her. And we've all worked together all the time on the same team, and they're really lovely, so it's nothing to be worried about. I want to apologise that I can't attend today because we did think that it might be too many people for your mum to meet all at once at this time, but I do feel really comfortable with you being in their hands because we're all on the same team. So how about I give you a call after the meeting and check in with you again? Is that okay?
Oh, okay, thanks, Amanda. Talking to you about this and getting help with the referral for counselling really helps a lot. So I'll look forward to speaking to you after the meeting.
No worries. Okay.
Okay,
Bye.
thanks. Bye.
Hi Liz, my name's Tanya. I'm the mental health nurse from the community team, and I believe you've already met Bertie. Hi Liz.
Hi. Look, before you meet Mum, Tanya, I just wanted to speak to you a bit about her. I'm really, really worried. She's not eating properly and she's just not herself, and she seems really distant, and to be honest, I think she might be depressed, and what if she decides to take another overdose? I just don't know what to do.
All right, well, it's not too surprising that you're feeling worried. Remember, at least she's only been out of hospital for a week. Okay, so let's have a chat with your mum and we'll take it from there. And I think Amanda is planning to call you this afternoon, is that right?
Yeah, she said she'd call, and she's been a real help. But Tanya, right now it's Mum I'm worried about, not me.
Okay.
All right, well, why don't we bring her in and we can see how we go.
Okay.
Where is your mum?
I'll go and get her.
Okay.
Mum,
Yes?
we've got some visitors.
What's this about?
They're coming in. They're the people from the hospital.
Hello, Jess.
Oh,
Nice to see you again.
Hi Bertie. I've seen you. I've missed you. Yeah, I miss our catch-ups. It's been a bit lonely here.
Oh, yeah, well, I've missed our talks too, Jess, but I'm really glad to see you back at home, settling into your own space. It's fantastic. And I want to introduce you to Tanya. Tanya is a mental health nurse on the team, and she and I work together with clients in the community. She's really great at supporting people in need, Jess, and I'm sure you're going to get along.
hi Jess. It's nice to meet you. How have you been doing?
Not bad, Tanya. Not bad.
So, Mum, I bet Tanya and Bertie really want to know how you're going and how you've been since you've got out of hospital.
Yeah, thanks Elise. We do want to hear about how Jess has been doing since she got out of hospital and how she's progressing on her recovery journey.
It's been horrible, Tanya, really. I can't really barely leave Mum alone for a second now. I'm so worried about her.
Okay. All right, well, let's hear from Jess, shall we?
Well, actually, Tanya, I think Elise sounds quite worried, so maybe it would be good to hear from her first. Elise, could you please tell us what your biggest concern is at the moment? And then maybe we can hear from Jess and we can work out a plan of how to manage the situation together.
Okay.
Oh, I'm really worried about Mum. She just seems so sad all the time, and she's not eating properly, and I'm really worried she's going to do something to hurt herself again.
Oh gosh, all you do is you just push me. You know, I'm not a child. I'll eat when I want to eat. I'll do what I want to do when I want to do it. You're pressuring me, and you're making me worried and concerned. It's enough.
Jess, what do you think about Elise's concerns?
I don't know. I just think, like, I know that she's worried. I understand that, but her way of showing it is shoving food at me and nagging me all the time. She's making me uncomfortable. I don't get a second to myself, and I don't want to make Elise worry. But I just wish that she would leave me alone. I won't try and hurt myself again. She just needs to trust me.
I want to trust your Mum, I really do, but you don't know what it was like when I walked in the other day like that. You don't know how it made me feel.
Jess, can you imagine why Elise might feel the need to be hovering over you at the moment?
Well, not really. I'm just tired of her being in my face.
Okay, Jess, that's fair enough to feel like that. But how about we pause for a moment and put ourselves in Elise's shoes? I know, personally speaking, I've been known to hover when I'm worried about someone and feel helpless. Don't you think that you might be worried if you'd found Elise after taking an overdose?
I hadn't thought of that perspective. Oh, that would destroy me. That would be awful. I'm so sorry, love. I hadn't given a lot of thought about how hard this has been. I suppose I've just been wrapped up in my own feelings.
And that's not surprising, Jess. You know, when someone's experiencing a depression, they often do find it hard to think clearly, and certainly it can be hard to even get through day to day. So it's not surprising that you haven't had a lot of, you know, mental space to be worrying about how Elise is doing.
Thanks, Tanya. Yeah, I hadn't really thought of that. No one said that to me before. It makes a lot of sense. Yeah, it is. I'm grateful for you, love. Everything you do for me.
Oh, that's lovely to hear, Jess. It's really interesting to hear you reflect on how this has been for Elise. Elise, how do you feel when you hear Jess say that?
Oh, I'm really grateful. I really am. It's nice to hear you acknowledge my feelings. And I don't want to make things worse for you. I love you and I want to make things better for you, not harder for you.
All right, so let's figure out the best way. What do you think, Jess? What do you think the best way is for Elise to support you?
Well, I need more space. I need some space. I need some time on my own.
Yeah, I guess I can understand that, but it's hard. It's hard for me to do that when I'm so worried that you'll hurt yourself again.
So, Jess, how do you think you can help Elise to grow her trust in you again?
Maybe little bit by little bit, I can start to do some things and get my independence back.
That's great, Jess. Perhaps I'm thinking we could start scheduling some alone time for you while Elise is just in the next room, and then we can work up to really leaving you on your own. So we could start with half-hour blocks just until Elise regains her trust a bit. What do you think?
Yeah, I've got some favourite TV shows that are half an hour. That could be good. That can be my time, and you know, without you, and you can do some things for yourself as you want to do.
Yeah, I guess I wouldn't be so worried if you were in the room next door by yourself.
After a bit more discussion with Tanya and Bertie, the two women managed to set day-by-day goals.
Okay, so that's really good. So I think we've decided that Elise is going to go off to her regular yoga class on Tuesdays and Thursdays.
Yeah, I think that's good. Elise needs to do some yoga. I think that would be fantastic for Elise to do some yoga, and it would give me that bit of time, and I need that time, and it could bring me that smoothie on the way back from yoga too. That would be a bonus.
Great idea, Jess. How about once you two are used to this routine, you and I could go out for a coffee while Elise is at yoga?
Oh, I'd really like that. That would be wonderful.
Oh, good. Yeah. And Jess, would it be okay if I came to see you again next Wednesday morning?
Yeah, that'd be okay. That'd be nice.
Good.
And Elise, you'll be touching base with Amanda again this afternoon, is that right?
Yes, I will be. Yes, thank you.
This concludes our scene from the lives of Jess and Elise. As you've seen, Bertie develops a warm relationship with Jess based on mutual understanding, just as Elise was encouraged by Amanda to work on her own self-care and to feel supported. When clinicians and lived experience workers partner with consumers and carers, we see the optimal model of older person's mental health, where every single member of the interaction has a role, a value and dignity. Spending time giving space to concerns and feelings with adequate supports through lived experience work, clinical expertise, medical treatment, active listening, and appropriate therapeutic interventions will hopefully become the standard of care for all services as we move forward. Clinicians may not have had the opportunity to partner with lived experience workers, and there may be assumptions about overlaps in roles, but working together, talking openly and respectfully will allow all voices to be heard and all participants to be valued.
And I'd like to take this opportunity to appreciate every single person who worked on this, contributed to it. So there was Tanya Cottrell, Benita Cohen, Amanda Bond, Alberta Gray, Elise Harriet, Jess Falla, and David Blum, who is the clinical nurse consultant in Alfred Health and Aged and Liaison Psychiatry, was also a consultant for the script. So at this point, I'm going to hand over to Benita Cohen. She's going to help orchestrate our question and answer, and all of us are available to take questions. And we hope you do have a lot of ideas and thoughts that this has brought. So I'm going to go ahead and stop sharing. Find my way back. Hello. It's like coming from the void, and open this up. If you have any questions, oh, thank you so much, Mark. You can pop questions in the chat, or you can raise a hand and ask a question. And I'm going to hand over to Benita now. Thanks, everyone.
Thank you so much, Jan. We'd love to hear any thoughts, reflections, any questions, and we've got around about perhaps close to 15 minutes or so left, so it'd be great to have some discussion. We thought the easiest way might be to put some things into the chat, and we'll do our best to go through them one by one. And as Jan said, we're also available. We'd love to be able to have a chat, perhaps at a different time, maybe over lunch or something like that. We'll just keep a bit of an eye on the chat box.
Would it be helpful for me to reshare the oh, thank you, Karen. Would it be helpful for me to reshare the triangle of care, the enhanced triangle of care, in case that might help spur some questions?
Yeah,
I can try to do that.
Thank you, Jan. It's yes, particularly helpful thinking about the kind of the lived experience partnership with our clinical team, having a way for each role to be clear and for each of us to support one another.
So Mark has a question, which is, what is the role of support groups in this approach?
I think that's a really great question. Let me let me go back to this. I'm gonna try and make it so it's bigger. It's always an easier thing said than done. Nope, I made it smaller. Well done, Jan. Okay, I don't know if you can see this. I guess I could do it from the current slide here. So, oh my God. Oh, nope. Always, never fails. The greatest moments here. Okay, I'm trying to move the team here, everybody's face here. Okay, so basically the role of support groups. So there's this wonderful place within the role between the consumer and the family supporter, and this is a really interesting place. So the clinical team, as you saw in the scenario, was doing a lot of interactive work. But we were also thinking about what about a consumer and a family that have even more complex problems. In that case, there might be room for family therapy, other supports outside of the service. There might be lots of other options. So we definitely thought that was a place. And as you can see in this area, so the consumer is the consumer peer worker is not only helping the consumer, but works directly with the clinician as well to strengthen that bond. And in a similar way, the family care peer support worker does this as well. So I don't know if that answers your question, Mark, but
well, I wonder. I wonder if I can add to that briefly. Yeah, just to say that I think the role of support groups is really critical for all of us. I kind of see a real role for everyone, from the consumer to the carer, family, as well as the lived experience and clinicians working together. I think it's something that we don't always have access to, and it's certainly something that is so powerful and positive.
Can I say something too, Jan? It's Amanda.
Yeah, I want to open it to our team. Thank you, Amanda. That's what I was about to do.
Just
Perfect.
Really quickly, I do often get, as part of a referral, a request to help a clinician or one of the practitioners in the team to assist to find, for example, a carers support group, and so that's often part of the initial referral, that clinicians have identified that the family or the carer or the supporter would benefit from that. And so often, as part of arranging, let's say, lifting from the scenario example, that time out may not have been Elise going to yoga. It may have been Elise being able to access a carer support group. They can be few and far between depending on what region you belong to. And part of our wanting to bring this up, especially at the start of the day too, is to raise, I guess, awareness that lived experience roles are really valid. They've been funded extensively as a result of our direct advocacy at the Royal Commission into not just aged but also mental health. So the roles are becoming available, becoming more widespread. They've existed for 20 years within adult mental health services, and yet there's an absolute deficit within aged mental health services. So I guess we're wanting to say that, that we're here and we're really fortunate at St Vincent's and the Alfred and a couple of other services to have representation, but, we're really underrepresented. So I'm happy to answer any more questions around that too, if anyone's got any.
Thanks, Amanda.
Sorry.
Tanya, did you or Bertie have anything you wanted to share?
I guess I was actually wondering, just looking through the different people in the audience today, whether anyone here has had experience working within the older adult mental health space with the lived experience workforce. Wondering if anyone had anything to say about their experience.
I would be interested just to know, if you put your hand up or if you did a thing in the chat saying you did have some lived experience in your service or in your workplace.
I think Mark's got a question. He's got his hand up.
Thanks, Mark.
Yeah,
that'd be great.
What a wonderful, we've got to say, what a wonderful way of explaining what you do and the role of the lived experience and the support as well. We were kind of outsider witnesses kind of to that experience, which is another dimension I guess we can use in this space. But I think the role of groups is something that we don't understand enough and use enough. We work in Swinburne in the residential care space, which has been very badly neglected, and the use of groups in a therapeutic way is in a way using the lived experience of people sharing each other's experiences. And I think we don't do that enough. I think using Zoom, especially with family support, opens up a lot of possibilities, much more than before, where for less commitment, people can get together from different places geographically to actually share their lived experience. So I think there's a lot of potential to use groups as a way of sharing lived experiences. And of course, as you point out, that informs our practice as well. So I think that's wonderful. And just thank you very much for that presentation, all of you. It was brilliant.
And I'm so glad you brought up about the group space. You're right. That is a very therapeutic space and certainly an amazing adjunct to this model of care. So thank you for bringing that up.
Mm-hmm.
And I see Marta has her
Yeah,
hand up. Hi, Marta.
Okay, so I'm from Bowen Health and a carer peer worker. My problem is, if your carer is elderly as well, trying to offer them some sort of carer group sort of support is really hard, because we're just expecting a lot from them, that they will understand the technology. We at the moment have to use WebEx, which is even harder to use than Zoom. Plus also, like, I know personally, my mum's internet is minuscule, the amount of internet access that she has, and also the understanding of it. So her wanting to use that internet for specific purposes, which would be more like contact with family at the moment rather than on a support group, is a real factor. And I think that, like, rurally at the moment, we're really confined to not much being available. So I think the aged are really not thought of in that respect, and there's nothing at the moment that we can really offer them unless they have younger people, carers, who are available at the time to help them with that technology. And that sort of is another burden on another family member to try and do this. So I think it's something we have to worry about.
It's a great point, Marta. I'm going to let Benita speak to that. Thank you.
Yeah.
Thank you.
Yeah. Thank you so much for that. And it's certainly something I know I see a lot in my both sort of work and family life. I feel like a lot of services have now been kind of delegated to just being phone calls, which is just so, it's better than nothing, but it is so inadequate, and really robs people of that kind of richer experience. It's really tricky, and I certainly hear some people I work with talking about how frustrated they are because they can't just see the person and have a conversation, walk across the road and kind of get to a service that they used to be able to get to face to face. It is very, very difficult. I think, having said that, we're probably trying to make the best of really difficult circumstances, and sometimes just the phone call, and sometimes they group phone calls. We can kind of link up, and some organizations kind of make that much easier, being able to kind of call together. And there are some comments in the chat which perhaps I won't go through right now, but there are definitely services that do help to set up group phone calls, or to try to support as best as they can. I think it still allows for an interaction. It still allows for that sharing of the power of kind of sharing and collaborating together. And yeah, I think even if that's all that we can do for now, it's still worth doing. We find, working in a hospital setting, we're not allowed visitors, and there's often kind of connection problems, internet problems, and those sorts of things. And so we do rely on phone calls, and where we can, we work around it. But yeah, I wonder if anyone else has any ideas of how they get around these challenges and the the particular lockdown and COVID challenges as well.
Actually, I can add to that too. I'll speak to my personal experience, not as a carer consultant so much, but as a daughter and a family member of somebody that is in an aged care facility. And I live regionally and they're metro, and we're a large family. And it's a really harsh reality at the moment that in order to be able to support that person as a carer, we are confined to having to ring during the week to make a booking for an appointment for a phone call and screen time. And I know that from a services perspective, that's also then really hard to deliver that, because it relies then on having staff members available to liaise, set that up, you know, keep an appointment book running, get the right person connected to the right person at the right time. It's really hard, and all I can say is it is tough for that brief 5-minute conversation where dad mightn't even remember which daughter I am in the family. It's still worth it, and it is all we've got. And I'm afraid if we can just keep our eye on the fact that it's temporary, these aren't permanent solutions, you know, and we need to really, in my role, really be reminding people that it is a temporary situation. Yes, life has changed irrevocably in so many ways due to a pandemic, but it's changed everywhere, all around the world. So, you know, we just have to go with it for the moment and make the best of the small time that we have. But I know I really empathise. It's really difficult.
I wanted to make sure, thank you so much for that. I want to make sure Nina's had her hand up, and I want to make sure we have time for everyone. So I'm going to hand over to Nina to ask her question, and then if anybody else has a question, we probably have time for one more. Thanks.
Yeah, thanks, Jo. It wasn't really a question, but more so just a little bit of an observation from my role. I'm a carer consultant at Eastern Health in Aged Services and senior care peer worker with the post-discharge team. And sort of something that really to the value that the lived experience actually brings to the space in promoting self-care is a really valuable one. If you think about the elderly, there could be years of different sort of traumas and things that have happened for them. There's probably some very big feelings and things and events in their lives that they've probably never really talked to a counsellor or anybody about. And they've buried those thoughts and ideas. So using my lived experience of saying, hey, look, you know, I was a carer for my mum and dad, and you know, my dad actually went and for the first time went and sought some help and guidance around his challenges with his feelings, and that worked really well, and he loved it, and he really has made a really good rapport. So, and they suddenly you have this sort of buy-in, and then people start to really explore the possibilities of, hey, if you know somebody can do that, maybe I can do that too. And so I've seen working with a lot of carers that can be very close to becoming patients themselves due to the stress and the trauma, and with being an older person as well. So yeah, being able to tease out and just have that kind of gentle conversation of the possibility of exploring is something that's really valuable for lived experience. Yeah. Thank you, Jo.
Thank you. Thank you so much for sharing that. That really is so helpful. I'm conscious that
I know, I am too.
yeah.
I want to finish with one more thing, if it's okay, Benita.
Please.
This was predicated not just out of the blue. So the underlying work, like I wouldn't expect any clinician straight out of school to be able to just do this, right? Like, or anybody in peer support necessarily to be able to do this. There's training involved in this. And so we definitely leaned heavily on single session family consultation underpinning some of this, as well as there's now single session peer work that's being offered through Beverly Center. So I just want to also give those bits of of information, so that if people are interested in this, there are places to do a little more research as well. And Benita, yes, I'm going to let you wrap this up, and I'm going to stop blabbing on.
Well, I thank you so much, Jan. Thank you for highlighting this, and thank you for including the resources. There's some fabulous comments in the chat. Thank you for everyone for listening to our discussions and sharing your thoughts with us. Sadly, some of the comments relate to the shortage of lived, experience workers in all our areas, and we can only hope that will change over time. But it absolutely has been a privilege to be able to, in our little group, kind of reflect the gold standard, how things could be if we were all able to support and listen and validate one another, and just how how valuable that would be for the consumers and the carers and families we work with. Thank you, everyone, and we're definitely available over the day. We look forward to speaking with you all and enjoying this wonderful packed day that we have ahead.
Thanks, Benita. It was such a great start to the conference. We really wanted to put carers, consumers, and at the forefront of our conference. And there's some great discussions there in the chat. Also, it was great to see that 2 services collaborated on this project, so that's fantastic. Our next session will start in a few minutes. I didn't know if people just wanted to have a bit of a stand up or a stretch or something like that before we went into the next session. But and I was just wondering if Joseph is around, if he could just put his, to say, give us a shout out that he's here. Oh. Did you want to say